I don't know what to. Can you hear me? How many people here for the first time tonight? They haven't heard me before. Okay. For the new people here, I'm going to just let you know that how I do my lectures. I usually give you some background about the subject before, and then we go ease into the lecture, and then we end up by having question and answer in the very end. Okay? The topic tonight is about the digestive system. And the reason we selected that topic because Shaklee has many products that can help the digestive system. And those products are, we know from the stomach all the way down. We have many products. You know, they have many products. I said we because I'm not a Shaklee distributor, but they do have many products that I recommend to my patient for the past 26 years I've been in practice. And then by discussing it with you tonight, I basically, what I discuss with you, my experience as an internist using these products on my patients. What result did I get? Are you following me or no? So that kind of clinical testimony is important. In the meantime, it's also important for you to know if you are in the business of selling Shaklee products, what kind of scientific basis you have behind it, because you might have heard about product X, Y, and Z in the market, and Shaklee is one of them, but you need to know what difference does it make if that product is X or Y or Z or Shaklee. Are you following me or no? And I will tell you the truth. There's nothing I shall except the truth because that's my clinical experience, what I do. If we look at the digestive system, we find that we have so many problems with our digestive system. We have so many problems with it. Those problems we have, I've been involved in it since I've been in practice. Everybody comes in with any problems, end up by having something wrong with digestion, always. Like if you come to me with a heart attack and I take care of your heart, when I ask you a question about your stomach, you always answer, oh yeah, by the way, I do have a problem there. If you have a problem with your period, yeah, we take care of these hormones. When I ask about the stomach, oh yeah, by the way, I do have a problem with that. Are you following me or no? That becomes bothersome to me because I never thought about it because I can eat any food in the world, it never bothered my stomach. And then I look here and why this bothering people doesn't bother me, you know? And I went to Mexico, I lived in Guadalajara, Mexico, for a while, and I said, you know, people eat everything. There's nobody complain of anything. You know, you probably, some of you have been in Mexico, you can see that. I went to Africa, I see people eating everything. There's no problem. Nobody complain about stomach. In Egypt, to my country, nobody complain about it. You know, people lucky to have anything. We come here, I said, I can do this, I can do that, I can do that, I can do this, you know, and I said, oh my gosh, what kind of a species is this, you know? This is something is wrong, you know, in people, that something is wrong in the digestive system, they can do that. So I wanted to just take you back a little bit to my history myself. Well, I lived in a village in Egypt until I was, 15 or 16. In a village, you live in an adobe house, you have a dirt ground and sand. You don't have any concrete. You don't have anything made of any material, plastic or anything like that. Everything from the earth right there, you live with it. So every day you get exposed to dust, you get to mold, you're exposed to everything right there. And you get cold, this, but you're never sick. Or if you have a runny nose or a cough a couple of days and goes away and you just keep going. And people, you know, in other countries, like in the United States or England, they will look at us and say, oh, how poor people, you know, they must be dying by the millions, you know. But we in the village, we were not dying by the millions or anything like that. We were just doing fine. We had people die from infections of that, but we were not like Cairo people. They filling hospitals, but we have no hospitals in the village. Are you following me or no? So there must be something to do with you live with your nature for 5, 7, 10,000 years. Must be something going right, you know. Otherwise, we'd be finished as a species, right? Then I go to Cairo and live there, and then all of a sudden I start having more colds, more flus, more of that. I said, well, maybe that's just the way the things are. Because I was not a physician, I was a nutritionist. Doing my PhD in nutrition, I said maybe that's the way the city is. But later on I discovered all the pollution and the chemicals and all of that. This was doing something to my immune system. But the digestive system never suffered still. Then I come to the United States and then meet Dr. Shackley and start my parents on vitamins and all of that. And then go to medical school and finish medical school and started practicing in cardiology and internal medicine. Then I started practicing preventive medicine and cardiology, preventive medicine, internal medicine. Then I started practicing pure preventive medicine. Then I find out the digestive system is still a problem. But I want to tell you, just before we get involved in the lecture, that when I compare my patients who are on good nutrition, include Shackley products, to compare to the other patients who have poor nutrition, I find out that there's a big difference. I do hear some complaint here and there, still some digestive complaint, but not as much as the other people have. So some of you here who are in Shackley for many years, you might have some digestive problem, but don't compare yourself to all these people I see that we have to, the doctors prescribing 5 and 6 different medications for the digestive system to just get them to go through the day. You understand or no? So you are doing much, much better than them, but for tonight we want you to do better than that. So what we're going to do, we're going to look at the digestive system and see how can we improve it, what can go wrong with it, what can we do with it. We're going to start with this is your mouth right here, and your nose someplace up there, and then this is your mouth, and then the food will come down right here and goes to the stomach, and then go to the small intestine, and then after that go to the colon, and then it goes out. This is called the digestive system. It has things attached to it to make it work better. It has a liver right here. It has a pancreas right here to help it. So that's the digestive system. So what went wrong with that? Well, there's a reason to worry about it. Number one, the digestive system is the only part of your body connect you to the outside world. It's connect you to the environment. It's part of you in the environment. It's the air and the water and everything you eat is going through you, it's coming out, so it's part of you. So it's a big system. Actually, this digestive system, if you take it out and spread it, will cover 2 tennis courts. The digestive system alone will cover 2 tennis courts. It has 10 trillion cells. 10 trillion cells in it. But when we look at it, we find there is something about it was designed different than other systems. To understand that, I want to take you, you have to understand, if you have any questions, keep it to the end, but if I forget something, write it down and I will answer it later. This system right here, when it develops inside the mother in stages. The first thing it happens that an egg inside the mother meets a sperm from the father. So we know that if something wrong in the DNA of the egg or the DNA of the sperm, it will create a child born with problems. Is that clear or no? So the digestive system can be born with the children. If you were here in the lecture I gave last time about omega-3, the Shaklee omega-3 complex, if you remember that. If you don't, there are DVDs outside. You can have it from the lecture. And if you remember the lecture I gave on Syndrome X about the sugar and the white flour, what does it do inside the body? If you don't remember, take more ginkgo acuity and you can remember better. But this lecture, we have said that the mothers who have children developed, who have deficiency of fish oil, their children will be born with allergies. Okay, if you don't remember, then look at it again in the DVD and find it. I repeat it again. The mothers who do not have enough omega-3, their children will be born with allergies or born with something wrong in their immune system. And the mothers who have taken omega-3, their children did not have these allergies. So this is a bold statement right there. We're saying that omega-3 is a miracle thing to have. And we proved it that day during the lecture by comparing the Eskimos, if you remember, with us. And we said that the Eskimos, that they put a fire in the boat and they couldn't do it and eat it too, probably doing better than us, that we know where to put the fire because we put the fire in our stomach rather than the boat. Okay? So they're actually smarter still than us. So these people, we checked them out, and we find out they have no heart disease, no stomach problem, no IQ problem, none of that we do have here. When we analyze their flesh, we find it to be in the body 60% omega-3, ours less than 1%. We find their brain, which is supposed to be 70% omega-3, ours less than 1%. It's full of fat, full of beef, full of pork, full of lard, full of that. You are what you eat. You know, the fat makes the cells, you know, and then if you have eaten the wrong fat, you're going to have the wrong fat, right? But if you have the right fat, then you're going to have the right cells. Because the cellular membranes, all I said in that lecture, made of omega-3. And also we said in that lecture that the eye, which is 90% omega-3 in them, ours have less than 1%. So, and also we said in that lecture for the new people right here, that if we replace that and taken 6 to 9 a day of omega-3, will take us about 6 years to catch up, okay, before you're going to see results. So that summarized the last lecture and bring it with this lecture, so you are part of the whole family then. You can. So we look at the children that are born sick. And when these two cells becomes one big cell, start multiplying, right? To 2, then 4, then we have more cells like this, and start making a sheet of paper in a sheet form like that. It looks like that, like a sheet, exactly. It's not a lump, it's a sheet. And that sheet does something very beautiful. It folds upon itself twice. I will use, let me use this paper right here. That's a sheet right there. It will fold once like this, and once like that. Okay, and we'll have how many holes? 2 holes like that. That's how the baby is made, like that. The top hole will make the brain and the spinal cord in the end, and the bottom hole will make the mouth and the rectum in the end. And the rest of the body will fill in, and the legs will bud out, and that's how miracle of creation is. You got the point, how beautiful it, how simple it is and beautiful it is? That is the 10 trillion cells we talked about, right there. That it has 200 billion nerves going through here, as big as this. That's a spinal cord right there, 200 billion going off them with the wires. It has 10 trillion cells of digestive system going through there to make the digestive system. So that's what happened. Now, when that baby develops and born, I'll bring it back right here, we'll put a baby next to it. When the child is born like this, then that baby has to face the world. What choice does he have? He has to get out. When the child gets out, he's still connected to the mother. He haven't taken a deep breath yet. But the first thing before he take a deep breath, his mouth will rub against the vaginal tube, the birth canal, where actually some of the bacteria of the digestive system goes from the rectum to the vagina all her life. This is a cycle like this. And you can say, how could it be? We're such a clean people. Well, we have clean God. He made it that way. He put them next to each other. So if you want to blame somebody, blame him, not me. But that's the way it's made. Okay? So what happened if we became so clean that we're not going to have the baby come that way ever again? We're going to cut right here and just take it out of the stomach. Then we're going to look inside both children. We're going to find 2 different bacterias, 2 different germs for at least 6 months to 3 years. And one will have, the one who was coming normal will have the germ that the mother had in her body, which is E. coli and strep. And the other will have other weird stuff in it, Clostridium, Pseudomonas, Klebsiella, this, all kind of weird germs in it. Because everybody's going to get germs from the air and the food. Are you following me or falling to sleep already? So this means that the normal delivery is better than C-section. Okay? That's the point we say right here. And it's related to the problem we have in society. Because how many people in our village, they were delivered by C-section? 0, of course. Where are we going to get it? We have no hospital. I remember one time, I come from school and I'm 11 years of age, or 12 or something, and my mother said, come and help me. I said, oh, go get me the lady who delivered babies. So I said, why? She said, because I'm going to have a baby. I said, oh, that's why you have a big stomach, you're going to have a baby. Okay, I didn't know that. Then I couldn't wait because she said, no, you stay right here. I said, okay. Then she just covered me, and then the baby will come out and go make something for me with fenugreek and molasses and some cocktail they make for every woman who having a baby. That's something since ancient time. Every house have it, okay? And she already know she's gonna have it, so she have it ready. That you boil it, she already boiled the fenugreek, that's a herb, with the molasses and everything, and she said, just give me some to drink. Once I have the baby, give me some to drink, not before. Then I helped her and I got the baby out, and then I set the baby right there and give her the stuff to drink, and I ran to the lady next door to tell her, come and help me with that baby. I don't know what to do about it. So how many children did she have? Total pregnancies. She had 9 pregnancies. How many of them lived? 6. And 3 died. That's okay, because that's the way it's supposed to be. So I have witnessed stillbirths, and we buried them. I have witnessed children being born and had an infection, cholera or pneumonia, and died, and we buried them. But 6 of the 9 survived. And my aunt, she had 17 out of 22 survived. And another aunt, she had 8 of 9 survived. So you can say, oh, poor thing, how come the other one died? Well, you know, that's the way they've done it for thousands of years. You know, there are some children will live, some children will die. But we didn't have a hospital. So these children, when they are born, they have their germs from the mother. Then they get the milk from her. And the moment they get the milk, that's why she wanted that drink to drink, because it makes the milk come out faster. The fenugreek does that, encourages prolactin secretion. I just learned that only a couple of years ago. After all these years, I didn't know that, why she did that. So the prolactin makes the milk comes out, comes from that plant, and many other plants does it. You know, soy protein does it. The shakla soy protein is a wonderful product for making mother milk also. So this milk, when she feeds the baby milk, the breast nipples itself have germs on it too, right or wrong? You know that we have germs all over our skin, right? So we look at the breast like this, and the nipple like that, and that's the milk ducts coming out. But the skin itself has cells with what? Germs. So she's feeding her baby her own milk with some of her germs. But that's part of her body. And she made the baby. So she introducing the baby to the world genetically, genotype and phenotype, and also from the environment together. Here is you are, and take what I give you. And surprisingly, every mother in the world gives the same thing exactly. It's amazing. Every child breastfeeding the whole world end up by having the germs that found in Aptoflora. Exactly. Every child, whatever you have in Shaklee, Aptoflora, that's what exactly comes for that baby. And the baby that go with C-section have a different kind of that until she give him her breast milk again, then he gets it again. And the one does not get breast milk at all and get the baby bottle, have completely new germs until later in life he be lucky or she's lucky if they can get some acidophilus or they can get some bifidobacter or lactobacillus or any of that. Be lucky. So what's going to happen to this person who doesn't have this friendly germ is going to grow with digestive problems. Are you following me or no? Is that clear or no? So let us look at the digestive system that we looked at and see what's special about it. What's special about it is when the food comes from here, that food can be protein or carbohydrate or fat or fiber or vitamins or water or mineral, right? But the protein that's coming in to that baby in the Western civilization is different from the protein is going in other places. Beside the mother milk I'm talking about now. What we eat as a nation, there are 2 types of protein God made. Animal protein and vegetable protein. Which one you think will be better for us? Which one we've been eating for the last 100 or 150 years? Animal, what McDonald's have. Animal protein. Do you think consuming so much animal products will affect our digestive system? So we say you are what you eat again in that. If you eat the vegetable protein, you're going to be healthy than the one who eats the animal protein. But the fish is animal. So we have to make exception. We say vegetable plus fish. But organic beef is also exception. Then we put beef. Also turkey and chicken, wild games going around, or deer running in the field. Also exception that comes in this good group right here. Are you following me or not? I'm not saying be vegetarian. We have tons of deers to catch. Of course, they're full of Lyme disease and maybe other things. That's your problem. But I don't hunt. But if somebody gave it to me, I will love it because it's a healthy food to eat. You know, it's a good food to eat. But most of people don't do that. They're eating animal protein that's processed with lots of product. Is this good for our system or no? The hamburgers in McDonald's and all this stuff, and it's not good. But that's what we've been eating. So you are the doctor, and I'm the patient. You have to tell me stop eating what? Junk food. That's the first thing you should tell me to do. The second thing, carbohydrates. It's good for us, right? It gives us what? Energy, right? And we're supposed to get it from whole wheat and whole oats and whole, right? That's our ancestor did that. But what's happening to us? We're too busy to fast. We start eating more what? Sugar and white flour. You're right. Sugar and white flour. And the other people eat whole wheat or whatever. Which one is better? Whole wheat is better, but this is not. So what's the majority of the people eat? Sugar, products, and white flour. And if you feed the body sugar and white flour, is the digestive system going to be healthy? We talked about metabolic syndrome. What happened when you eat white flour and sugar will go to the liver, 30% go to the brain to feed the brain, and 70% of white flour and sugar include juices. Even. It's funny that when you eat the apple itself, it never give you problems, but the apple juice will. The orange itself will never give you a problem. Even if you eat a whole watermelon this big, it will never give you a problem. 20 apples will give you a problem. 20 oranges never give you a problem. 1 glass of orange juice will give you a problem. 1 glass of apple juice will give you a problem. It is the glycemic index. It's the sugar load on the liver, and we just discovered it a couple years ago that the sugar on the liver is too much, to the point that the liver will only use 30% to the body, and the rest will convert to 3 substances. 1 will convert to LDL and VLDL and homocysteine, that clogs arteries. Number 2 will convert to a substance called celamide, that's in the syndrome X. So if you cannot catch me talking fast, get the DVD back there. Because Joyce made it, so you have to buy it. So in any way, the second substance called celamide that it goes inside the nucleus and causes mutation. I have to cover this fast because it's not really part of the lecture. Just came in my mind right now. And the third substance the liver make is called insulin growth factor hormone. Insulin growth factor make you grow when you are adult. And when you're adult, you can grow. But what part of you will grow if you're adult? Soft tissue, right? The soft tissue. So the breast will grow, become cancer or cyst. The uterus will grow, makes fibroids. The ovary will grow, make cancers. And the girls will have period too early because it grows too fast. You know, rather than 17 and 16, now it becomes 11 and 10. And then the prostate will grow fast, then we have cancer. The colon will grow fast, we have polyps. The skin grow fast, we have tags. All of this from the white flour and sugar that our parents gave it to us, plus we do it. So we have treated our digestive system badly, and don't expect me tonight to say to you, oh, I got a magic cure for you. If you take the Optiflora and the EasyGest and the Alpha and that, you're going to be fine. You're not going to be fine unless you change your habits. Habits has to change. And then I go to conventions and convention of nutrition people, Shackley and others, and watch from outside what people do, what they eat, what they drink. And I get shocked. I said, you are the people who are supposed to teach nutrition. You eating sugar, you drinking juice, you doing this, you doing that. And then I just shake my head and go back to the class again and sit down and listen. Because we got to be what we say. And anybody with double personality is psychotic. Okay? If you teach people something and you tell the children something, you do it yourself. Don't tell the children, don't drink alcohol until you're 18. You said, don't drink alcohol, period. Don't smoke until you're 18. You said, no, don't smoke, period. Don't drink sugar until you're 18. No, show them yourself that you are the example in the home they have to follow. You follow me or no? Because children are very intelligent if they're taking omega-3, and they are dumb if they're not. But they still observe you as a dumber person if you do something wrong. And they will tell you when they get to be 8 or 9, I thought smoke is bad for you, how come you're doing it? I thought drink is bad for you, how come you're doing it? I thought lying is bad, how come you're lying? You follow me? Kids are pure heart. They just say it as it is. And we really need to make some changes ourselves to be a good role model for them. Because if we don't, what happens? They will have a role model by some gang or some bad person outside, and they will learn the wrong thing from TV or video games or DVD or something, and we have a collapsed society. So this is the carbohydrate. The fat also, we have consumed, there are two types of fat. The vegetable fat, which is oil, any kind of oil, and the animal fat, which is lard and margarine, which one we have been using for the last hundreds or more years? The animal fat. Is that good for the digestive system or no? So we got to go back to the oil. We got to go back to which oil? That's somebody going to ask me that. Don't ask the question, which oil? Don't even ask any question about it. All oils are good oils, except castor oil or mineral oil. But oils from plants are some better. Olive is better than this. Canola is better than this. You know, don't get so specific. Get the least expensive cold processed one and use it, and that's good enough. Yeah, the less expensive cold processed, that's good enough. But I wouldn't go to a guy who's selling me a little bit of olive oil for $16 this much. I said, why? Why? You're supposed to give me a whole gallon for $8. You know, and that's what sometimes you're going to have to shop around. That's why we have Whole Food for. And Trader Joe's and things like that, they compete now and they're producing good products in the market. Now, this is why we have a problem with the digestive system. Fibers. These people group here eat fibers. Most of people don't eat fibers. So we have a problem with fiber. Our ancestors consumed approximately 150 grams of fibers a day, and the average American consumes 9 grams of fiber a day. 9 versus 150. Fibers are good. They make the bowels move. They do lots of good things. So if that's part of the lecture also. And water. Is water good for the digestive system? Of course it is, because the food has to be liquid inside, doesn't have to be solid. And what kind of water? Not beer, not alcohol, it means water. And you got the best water in your company, the best water filtration system probably I've seen around, and reverse osmosis, and you can do that. But most of people don't drink good water, don't drink water. They drink Coke and Pepsi and soda and all of this, right or wrong? Right. Water to them means you swim in it or take a shower. It doesn't mean you drink it. And the government encourages that, by the way. They tell us not to drink water. Because I saw, of course, some of you listened to me over the years yesterday about the ad, again, we say it, of the guy walking the desert. Remember that I said in the lecture, the guy walking the desert, he's so thirsty, he comes to this house, and he's so thirsty, somebody gave him a glass of cold water. He said, no, I want straw beer. Do you remember that? Anybody remember that? Raise your hand. Okay, so you remember that. That means somebody approved that ad. It's not going to affect me, but it's going to affect the children. Right or wrong? They go after them, not us. We're too smart to follow that, but the children are not. And also in the Olympic Games, you hear it in Super Bowl. You see somebody, you see the girl sitting and the guy swimming in the swimming pool, or the guy sitting, a girl is swimming, and comes outside, so thirsty, and takes a Coke. If you're so thirsty, why didn't you drink from the pool? You know? Even with chlorine, it's still better than Coke or Pepsi. But that is the programming we have, that water is not good for you. That you got to have something. You got to have at least 8 ounces of water, or 8 glasses of water a day, which come to 64 ounces. And those people drink water. So in general, right here, the problem started from your mouth. That's the problem number 1. Number 2, we go inside the stomach. When you eat the food here, you have to chew it. So you have to have salad, and hard salad with food to chew and chew and chew, because chewing releases saliva, which is good for the mouth to clean it, and also good for the digestive system. It has enzymes to break down that piece of bread or meat, break it down a little bit so you can absorb it. So if you are chewing an apple, and you keep it chewing it for half an hour even, you're still not going to break all the cells. It still goes in the stomach in lumps. So you get only 30% sugar, and the rest of it go through you. That's why fruits are better than eating sugar. When it comes down here, there is a guy sitting in the stomach like this, with a binocular looking up, and he will see you what you're eating, and he say, oh, he ate Big Mac. So he have a telephone next to him right here, and he will call the brain, tell the brain is right here if it's there. He call the brain, tell him the guy just ate Big Mac, or ate some bread, white bread. What should I do? He tell him, don't worry. I will call the pancreas to tell him to secrete what? Enzymes to digest the food. But if the pancreas is too tired from working hard all the time, secreting insulin for all the sugar, it's not going to secrete enough what? Enzymes. No, it's working hard to secrete insulin for sugar. So the cells next door secretes. The pancreas is divided to 4 cells like this. This is the pancreas. 1, 2, 3, 4. Alpha, beta, and gamma, and delta. So the beta is the one secrete insulin. But the gamma is the one secrete glucagon. And the alpha secretes enzymes. So when the beta is so busy working hard for secrete insulin for sugar, the alpha gets tired. You got the point or not? Because it's swollen. The pancreas gets swollen. So what happened? We have less what? Enzymes. So when we eat that kind of junk food, we're going to need some easy jest to take with it. That's why easy jest was part of the lecture. So when you eat a meal, you have easy jest with it to help your what? Pancreas. Because if we don't, it could develop disease called diabetes and lead to syndrome X. Do we have diabetes problem or no? Just let me give you a small example. You know me for many years. 6 years ago, cancer was killing 600,000 people, heart was 600,000 people, diabetes 30,000 people. That's 6 years ago. Right now, cancer killed 1 million people, heart 1 million people, and diabetes 900,000. You got the point, from 30,000 to 900,000 in 6 years. Is that bad or no? Now they predict next year, 2006 statistic, diabetes will kill 1.2 million and cancer will be 1.1 million, 1.1 million. So we have a problem with sugar and white flour and that stuff. We better take care of yourself because syndrome X will kill you. It will make you make insulin growth factor hormone that makes your body grow in every direction and have cancer here and there and there and there and there. And the answer is very simple. Treat your digestive system properly, you can reverse the problem. Now, the food get digested in the stomach, get digested. It takes about 3-4 hours if you're eating fish, if you're eating chicken. It takes maybe 4 hours if you eat beef. It takes about 6 to 8 hours if you eat pork. And then the food will come to where, this is stop number 2 here, to stop number 3. What is that? The small intestine. What does it do? Just think about it. Absorbs. Absorb the food you digested, right? The good food. This is what the lecture is all about today, about that small intestine. That's why we're talking today about. The problem with your stomach, let me see where I am in my notes because I don't want to get lost also. Let me follow my own notes. Okay. Yeah, okay. We'll get to that other stuff in front of me later. The small intestine, it looks like this, and it has hair like that, cilias like that to absorb, and it has, what are these things here lying like that? Cells, right here, cells. And those cells are touching each other. I am going to just cancel some of the stuff I was going to talk about here but before I do that, I hope I remember to get back to that. This is the diet of our ancestor, and this is modern diet. I really need to put that back on because I was going to miss it, if I don't do it now. That the fibers, they consume over 100 grams, we consume 9. The carbohydrates, 41%, we get sugar, 50%. The fat, 22% fish or unsaturated, we get 30 to 50% saturated fat. The protein, 37% from wheat and things, we get only 20%. And so on. So there is a big, look at the potassium here. Where is it? Up here. They consume 10,000 milliequivalent, we consume 150. And you know how important potassium is to our muscles and contraction, spasm, and all that. It's so important to us to have enough potassium. So we better go back to fruits and pay attention to that. And another one I put in my hand here because for the new flora, those type of bacteria that your mother gave you, which you don't have right now, that's why you have gases, some of that bacteria will go backward and start growing inside where? Small intestine. That is the problem of gas and bloating. It's bacteria in the small bowels. And even candida can go there too. But mostly bacteria. Majority of bowel problems is not candida. It's bacteria. Why? Because we have 100 trillion bacteria in the intestine. 10 times the amount of cells in the digestive system. We have 10 trillion cells, we have 100 trillion bacteria. From that, it's supposed to be friendly. It's supposed to be friendly to us, but is no longer friendly. It came up here and started growing in the small intestine because the small intestine cannot resist anymore, cannot fight back because it's sick. So we have what we call irritable bowel disease, Crohn's disease, ulcerative colitis. Even we cannot tolerate little gluten. My gosh, how sick can you be if you cannot tolerate gluten? You cannot tolerate even milk. You are really sick if you cannot tolerate milk. And you have a doctor even tell you, milk is bad for you. Since when milk is bad for us? You understand or not? Our milk in the United States feeding the world except us. You follow me or no? It is sad that we live in butter, we live in milk, we live in gluten, we live in wheat, we live in everything, and we become isolated that we are sterile. I don't know if you heard about the hygiene theory. It was developed in 1988. Hygiene theory that everything has to be sterile, has to be perfect. You cannot have anything you're allergic to. Nothing. If something upsets your stomach, you cannot have it. Remember, the baby was born, the first thing you have cramps and colics and all of that. Why? Because you introducing milk to him is not used to. So he have to have colics. But if we get some gas and colics, oh no, we cannot do that. So what happened? We stay away, we stay away, stay away. Now we become what? Sterile people. And believe me, I was invited to take the American Board of Holistic Medicine October 14th. Okay, this coming October. And that's 200 doctors got together. They decide, and professors from university, medical school, the best in the country, they got together and decided to make a board to challenge the American Board of Internal Medicine, to challenge the AMA. And they made the board. And they invited the internists who have experience with nutrition to take the exam, to be certified. So I have to become a student to learn from them, just like everybody else. So they send me 622 pages I have to read. Then I have 90 tapes to listen to. And just like I'm learning, just listen to. I disagree about 10% of the stuff, but I knew 70%. I didn't know 20%. I disagree with 10%, but doesn't matter. The 10% is going to be in the exam. Or I better disagree, and better write it the way they want it. Okay, so I have to go spend $3,000 fees, tuition, and take 12 hours a day classes with 5-minute breaks for 6 days, and 5-hour exam. And if you pass, you become one of the people who are board certified in holistic medicine. And I bet you this is planned by the government or universities to have physicians in nutrition to oversee the food supplement in the market. So it's good, it's really good field, I like it, but I believe that's what the FDA is going to use us to tell them which company have good product, which company has a bad product, and the bad product we can tell them, take that off the market, keep that in the market, and that's probably what's going to happen. Because I can see those people who are teaching, there are professors, some of them have Nobel Prizes and they teach in nutrition, they believe in it. but I think they're going to be very powerful against the AMA and against internal medicine, and was going to be very successful. So during that study, you know, I learned things I didn't know. One of them I didn't know, is those bacteria travel backward, and it is bacteria. It is not Candida. There is Candida, but it's mostly bacteria. I thought it was Candida. No, it isn't. It is a bacteria. So in that case, the answer was simple. We give the people better diet when they have Candida and gases and bloating and all of that. We don't have to put endoscopies and upper GI and lower GI and all of that. We don't even have to do stool analysis, because stool analysis most of the time is going to show lots of things. No, we don't want to waste even money. What I did with my patients, I said, okay, this is mostly bacteria. I'm going to give you the Optiflora, I'm going to give you the EasyGest, and I'm going to give you 10 days course of antibiotics. I'll see what happened. We did that. When we did that, we find out 48% have no longer any symptoms. They were done. But we discovered another problem. We discovered that the people who have leaky gut syndrome here, they have so much inflammation, some of the antigens, antibody reaction between the bacteria in the small intestine created diseases inside the body itself. Asthma, allergy, fibromyalgia. Yeah, fibromyalgia patients, we find 100% of them have bacteria in the small intestine. 100%. And when we treated it, 48% got better with the EasyGest and Optiflora and all the stuff we talked about. You follow me or no? So the reason for the bloating and the gas was nothing to do with the colon itself. It was to do with the small bowel having bacteria inside it. And we must kill those bacteria and take Optiflora and EasyGest. How do we do Optiflora? One, you take the Optiflora, but you must take the pill that comes with it, the oligofructosaccharides that comes with it, because the definition, let me just get rid of some of these charts. Let me see the time. Oh, we only have half an hour. I haven't even started yet. Okay, we just get rid of some of the stuff so we can talk about the lecture itself. Okay. I have made some summaries right here about Optiflora and leaky gut syndrome, and I wanted to tell you what I have learned from my course. Oh, here it is, about the different Optifloras. That's what my course taught me about it. That must be the product that you take called Optiflora. We call that probiotic. Probiotic means a bacteria. Prebiotic means the sugar comes from the company with it. So you must take the pro and the pre. You follow me? Because the pre is what makes the pro multiplies. And the sugar, special sugar, it doesn't get absorbed, so it feed them, so they grow so rapidly and they eat the other germs. And that's how they work. They eat the candida, they eat the yeast, they eat the others. They're just full of appetite. Those three bacterias, they have it on. Anyway, it has to be, if somebody makes Optiflora, lactobacillus, bifidobacillus, or any of that, it must be made non-pathological. Cannot hurt you. So lots of the companies putting bacteria in the market, they don't have FDA regulation to know even they don't have even cholera in theirs. Are you following me? There's none. So it must be non-pathological. It's not going to hurt you. Are you following me or no? Number two, it must be resistant to acid in the stomach. Means it has to be each one encapsulated with antacid. It has to be manufactured that way. It has to be resistant to the bile in the small intestine by the gallbladder. And 99% of what I see in the market doesn't have that. It must adhere to the intestinal wall epithelial tissue. It must attach itself to the small, let's go back to the small intestine right here. It must adhere to the cells right here. It must attach itself right here to the cell. Must adhere to it, to protect it, to eat the germs that's coming inside. You follow me? Must be. And the majority of the one in the market, it doesn't have that. Why do I say that? Simple. If a company tell me that I spend so many $1 million on research, and a company other tell me, will not tell me on it, will not even tell me if they're spending any money on research, like Life Extension, for example. It's a great company in advertising their products. However, I ask him, where's your lab? There's none. They outsource, companies to make product for them. They have none. So I have to be careful what I hear, what I do. I like their knowledge, but I don't like all their products. Are you following me or no? So be careful with what you get advertised for. It becomes dangerous. It must be able to multiply and colonize the intestine. It has to multiply fast. So we cannot eat old bacteria and optoflow. It has to be young. Young bifidobacillus and young lactobacillus, not old. Because the old's going to die once it gets to the intestine. It must multiply. And it must have the ability to kill the bad bacteria inside the intestine. And all of those will fit in the Shaklee program. I would like to mention to you also something very important, and this is taken from actually the course I'm going to take the exam in, so I got to say it. They said the best way to learn is to teach, so I'm doing that now. How do you know you have an intestinal problem, digestive problem? They also say that in the course to us. How do we know? We must tell the patient, you answer these questions for us. If you have relief, if you have discomfort or gas that's relieved by going to the bathroom, then you have a problem. If you have change in the frequency, you're going more often than used to, you have a problem. If you have a change in the form, consistency, you do have a problem. And you must not have any of the following. If you, you must not have anemia, because if you do, you must be bleeding someplace, and the blood give you gas, so we have to take care of that part. You must not have any fever with the stomach problem. You probably have like typhoid or something else. We'll have to take care of that, or parasites. You must not have any blood in the stool, because if you do, we have to think about infection and cancer. We cannot blame it on bacteria and stuff like that. We're going to rule out that. If you are over 50 and you have discomfort, then we must find out why you have it. If you wake up at night, you have to go to the toilet, not urine, stool, that is a problem. If you have used recent antibiotic and you have a problem, it could be candida or could be yeast infection. If you lost weight and have a stomach problem, you might have cancer. If you have a mass, you feel your lump in your stomach, be careful. You don't have a small bowel problem. You might have other problem more serious. If you have persistent diarrhea, also, then you have to find out. So we have to understand in medicine or in health, we must know the root of the problem before we treat the problem. And if we don't, believe me, you're going to be the loser yourself. Because don't waste any time with anybody recommending this and this and this and this. If you have a problem, change your diet, change all of that within a week. If you still have it, then it could be some of those things we're talking about. What I wanted to say here is the optoflora, because I want to put that on the tape right now. we have checked it carefully to see what else does it do. It does help the stomach in many ways. It helps the immune system. It helps against candida. It helps against bacteria. It helps against colon cancer. It helps against lactose intolerance. By the way, all the stuff I'm telling you has been published. It does help against H. pylori, the stomach ulcers. It helps against GERD, the reflux esophagitis when the acid goes to the lung. It helps against that too. It produces immune factor inside the intestine that makes it makes their own cells attack other bacteria and cancer cells. So in general, it's a good product. Okay. I wanted to mention something important here that is really happening to all of us with gas and bloating and all of that. When these cells separate from each other, there is something else happens that you're not aware of. Some of these bacteria, they look like, let me get a different color. We have, the bacteria looks like this. It has an eye, mustaches, and legs like this. And there are 100 trillion of them. Once there is a space, they go where? In the space, they go where? In the blood. Go into the liver. They go in the blood. When they go in the blood, you don't know that. You might have a cramp or something like that, but immediately the body is supposed to fight them. So the white blood cell will come like this. Why did this black color keep coming in my hand? Okay. The white blood cells will come like this. This is a white blood cell. And the white blood cells will turn it this way. They have binocular in their hands like this, and they have an eye, and they're looking around, and they look at the thing right there, and they find something looks strange in the blood. They will have a little telephone right here, and they call the lymph gland next door. Did you know this? That 70% of your immune system in the guts, 70% of the immune system in the bowels, 70%, because that's your connection to the outside world. And you must be protected. You must be protected in the nose, in the mouth, in the stomach, in the guts, all the way to the rectum. You must be protected. Otherwise, the germs will just destroy you in a second. You understand? Imagine a germ going in the blood where you have protein, carbohydrates, fat. It's nice and warm. There's no other germs to compete with. They will multiply so rapidly, go to the heart, cause meningitis, endocarditis, hepatitis. You name it, they will do. Right? You know, some of you nurses, you know septicemia is very dangerous. So the white blood cell will identify them. That's true. And notify the lymphatic tissue. Tell them, I seen a bacteria with 6 legs, and I am going to stick my tongue out and taste it. So the white blood cell have phagocytosis. They stick arms like this, and they feel all the holes in the body of the bacteria. The bacteria have holes to breathe and eat. They want to identify how many holes, what they look like, what are the sizes of each hole in the bacteria, and notify this guy here. So when the bacteria passes here, comes like this, I just do it blue right here because I don't want to change the color, then this guy is here, releases nails like this to fit exactly in the holes in that one. That's called antibodies. That's good. But if it's too much, then we have inflammation inside the body. The immune system is busy, rather than fighting cancer, fighting bacteria. Are you following me or no? So they leave the battlefield and they fight something else. Is that good or bad? That's very bad. So the person's immune system gets compromised. And beside that, the bacteria sometimes wins and releases antigens like poison, and the person starts developing asthma, that's antigen. Allergies is antigen. Crohn is antigen. Rheumatoid arthritis, multiple sclerosis is all antigens. Cancer is antigen. It's autoimmune diseases, all of it antigen. So there is something I learned in that course I didn't know before, that these diseases even related to digestive problem. And we must pay attention to the digestive system, that we must give the patient who have all these diseases better diet, and that will bring us to the end of the lecture, that this is the digestive problems right here. We then must do something about it. First of all, we must have a diagnosis. What causes the problem exactly? Are you following me or not? Don't treat symptoms. Treat the cause of it. And nobody will know the cause of it except the doctor who specializes in that disease. If it is a stomach, then a gastroenterologist. If it is heart, then it's a cardiologist. If it is a brain, then it's a neurologist. Are you following me or not? If it's a joint, it's a rheumatologist. That's why we have the greatest country in the world here. Why? Because we have refined medicine. Now we just need to attach nutrition to it, and we'll be number one in the world in everything. And if we do that, then the whole world is open for us. We don't have to invade Iraq by forces, but we can invade it by nutrition. We can invade China by nutrition. We can invade the whole world by making the whole world our field of good nutrition and hope and love and health. And you walk any place in the world, nobody hates you anymore, because you are there to help them. This is why I believe I predict Shaklee will be maybe $40 billion company in the future all over the world, if it continue to grow the way it's done now with the new owner. Because it's a well-organized company, spent millions of dollars on research, and I believe in that. It doesn't mean it has everything. It doesn't. But that's the way you must understand. We must have a diagnosis. We must have the vegetable protein. Soy protein is very good for intestine, and if it bothers you, then it's your problem. You don't stay from it. What if you, the doctor, I'm a patient, I tell you, if I eat 2 scoops of protein bother my stomach, what would you tell me? Eat more. No, eat more. Yeah, no, it's not that way. The American Board of Holistic Medicine taught us the following. If something bothers you, consume a little bit of it. That's what they taught us. If something bothers you, consume a little bit of it. Get your immune system used to it. How long it takes, it doesn't matter how long it takes. You hear these days about the peanut. Kids are allergic to peanuts. Gosh, I never heard about it. I love peanuts. And what's going on? Even peanuts, now they can eat it? Or what should I do if I have a child with peanuts allergy? It's a liability to give him peanuts, of course. But what will I do? I will put the child on Benadryl. I will give him 1 single peanut a week for a year. And see what happens with Benadryl on board every night. Can you have allergy when you have Benadryl on board or no? Probably not. Because Benadryl is anti-what? Histamine. So if you're blocking the histamine before the histamine comes out, you blocked it, so you are safe, you don't have the fear. Are you following me or no? We do it with penicillin. If you come to me, you're telling me, I'm not sure if I'm allergic to penicillin or not. What do I do? I give you Benadryl in the IV and some steroid Then I give you penicillin injection, high dose. See how you react. If you start swelling, getting swollen, I know I did the protection, or I give you some little bit of adrenaline, and then it's okay, and you're allergic to penicillin. But if you're not, you're not. But allergy is something you don't have to pay money to go to allergists to get sensitized by peanuts. And this and this and this and this, and each shot costs so much, and spend millions of dollars on it. No, we don't have to do that. We can sensitize the food itself. You follow me or not? A strawberry, anything. Just consume the smallest dose that it doesn't bother you. Then get used to it for 6 to 8 weeks. Then increase it and see how you feel. Increase it again and withdraw the Benadryl every other day, and then see how the body, and you find out the immune system. You're teaching the immune system to be strong. Even cancer, we might do that one day with cancer. We might induce cancer cells, antigens, in the body in a small quantity, and let the immune system identify it. So when the real cancer comes, it will kill it. You understand? That's how we're going to succeed against diseases, is by teaching the immune system. So the protein, soy protein is important, and vegetable protein and fish. Carbohydrate, whole wheat, please don't forget that. Fat, don't forget the oils I talked about. And don't be so particular about this or that. As long as it's cold processed, just enjoy it. Would I enjoy olive oil with eggs? Of course not. It just smells. But would I enjoy olive oil with feta cheese? Yes, I do, because it smells good. You follow me? You got to enjoy the meal in front of you. So that is what we don't want to be particular about oils. Oils are very good, most of them. Olive is one of the top oils. Flaxseed is one of the top oils. But corn oil is fine, and why not? If I get it, for cold process for $5 for a gallon, I'm going to have that rather than paying $20 for a gallon, because the gasoline, I'm going to spend the extra on the gas anyway. So I have to save it for the gas money. Now, that's protein, carbohydrate, fat. Vitamins, you must add it to the diet. Water, minerals, fiber, add to the diet, like we talked about. Good diet is followed like this. Eating fruits frequently during the day. Every 2 to 3 hours, a piece of fruit. Teach your body that. If you feel yawning after lunch at 2 o'clock, you eat the meal and you yawn, you want to fall to sleep, you have hypoglycemia. If you eat some fruits frequently, you're never going to yawn. You're going to have energy all day. Some people will say, yeah, but eating fruit is going to feed the yeast. Come on, what are you talking about? Where do you get medicine from? No, it's going to feed the stomach and the intestine, and we're going to kill the yeast is not there in the small intestine. We're going to get rid of that. It's true. If you have lots of germs in the small intestine, you better get treated for it with Optiflora plus antibiotic to kill it, then move forward without spending lots of money on testing. There is no reason for that. It's a big market. Testing is a big market. We try to be careful not to have the patient waste so much money, because people don't have enough money on testing. Then, I wrote the fiber on the glass rather than the slide. I guess the slide is very clean then. Okay, or I need glasses maybe. Okay, anyway, I put fiber next to it right here. So the next thing you have to do in the treatment is the stress management. Is the stress management help the intestine or not? Don't eat on the run. Baby food should be warm, not cold, not hot. I learned something in that course from another professor from another university, gastroenterologist. He was against anything ice, cold. Completely against it. He talked that in a lecture. He said, that's wrong. I don't think it's that wrong, but in the exam I'm going to say it's wrong, But, the kids eating ice, and he said that's too cold for the intestine. Intestine has to be warm. And the baby especially, you know, you get the milk and you feel it with your hands before they eat it, because that's the right temperature. Why give him ice cold stuff? He will have colic. Same thing with adult. They say food should be warm. So since then, I have discussed that point with my grandchildren. And the next meal, the grandson was supposed to sit at the table. We always have the water with ice. And all the water was without ice. And I love water with ice. So with the ice. He said, you said ice not good for you, and then I put water without ice. So I said, you're right. I don't like it, but that's right. I'm going to drink it. And he was testing me, and all of them were enjoying it without ice. Because I was the one who liked it, but the kids didn't mind. Regular warm water, they didn't mind. You follow me? It's teaching really that. Now, stress management is important, that when you eat, take your time. Be in a peaceful place. Don't eat in the run. Don't be in the car with a plate in your hand and eating and driving at the same time. Because that is not a good meal. You understand? Eating supposed to be enjoyed. Because your body cannot do two things at the same time. And the blood going to go to the intestine anyway when you eat, so it's going to leave the brain, so you want to enjoy the food. So it's supposed to be in Europe and in places like Egypt, all that, meal, the big meal of the day is some event that preparation and calmness and takes like an hour rather than 5 minutes. Stress also with exercise. You can exercise help the digestive system. When you exercise, it helps the digestive system because it takes the food, it takes gases out, takes the food out, and it helps the digestive system. Sleep also. Having enough sleep helps the digestive system. The digestive system, immune system, it needs 8 hours sleep. Pray or meditation or prayers, it helps the digestive system because it increases interferon. Now, the last one, this is 1, 2, 3, and number 4 right here, detoxification. Interferon, increases interferon, that's a substance fight cancer in the immune system. By the way, we're going to talk about that in the next lecture, so I'm going to see if you're going to come. The neutrophil is going to be in the next lecture. I'm going to look for you. So the neutrophil, we're going to talk about a lot about that. The detoxification, how? Water should be clean, air should be clean, food should be clean, and I'm sorry?
Wash your hands.
Wash your hands. Well, actually, that's even is not detoxification. Actually, they find out in that course that people who use their hands to eat rather than fork have a better digestive system than the one who use a fork. That there is sensation in the hands that you can sense the quality of the food, and your mouth starts salivating, digestive, when you feel that drumstick in the hand. Then there's one. There is a study being done, it does help that. So the hygiene theory, yeah, up to limits. Wash hand, yeah, you're right, I wash my hand, but it doesn't have to be too clean. I don't have to be like Howard Hughes, I don't have to scrub it. So detoxification also means that you have to look at the food you eat at home, see how many chemicals in it. When you eat fast food, it has chemicals in it. When you eat in a restaurant, it has chemicals in it. So you're going to minimize the exposure to the outside world chemicals. Another thing we do chelation to remove lead and mercury from the body. Plus we do methylation to remove the homocysteine from the body and build the immune system. So detoxification is important. So diagnosis, diet, stress management, detoxification, and that's all for you for the lecture tonight. Thank you very much. Okay, I'm going to take some questions. I'm going to give you my phone number is 847 571-3914. That's my cellular number. I just switched from AT&T to singular, so I cannot call my voicemail very well. But at night time, I've managed to get it, and the guy told me, it's your problem, you have to listen, take notes, and then call him back. Used to be you push a button, you automatically down, now we're going backward. So I will call you back, but it might take a couple years. But this is my cellular number. No, it takes 2 days now, rather than 1 day. The second phone is my office, is 847-356-9009. That's the office. The home, I don't use it anymore. I don't even answer it. So now, we're done with the lecture. You got the phone numbers. We're going to take questions from the front to the back, okay? I'll be with you in a minute. So you're going to be, no, don't get upset. You know, you're going to be here until tomorrow, that's all. Okay, yes.
My stepdaughter, when she takes, I've got her taking after work.
I'm going to repeat the question, by the way.
She cannot seem to tolerate the powder. Was that probiotic?
Mm-hmm.
She can take the pearl, and when she takes the powder, she gets very, very sick.
Okay, her question, when her granddaughter takes the prebiotic, the powder, she cannot tolerate it. That may be true. So what you have to do, you're going to cut down both of them to 1 a day and take them with meals. Okay, the question was, when her granddaughter takes the prebiotic, which is the powder, she cannot tolerate it because the bacteria in the probiotic multiply so rapidly that she has so much bacteria. Probably she's young, probably. Then what I will do, I will give her 1 of each with meal every other day or once a week, then train her slowly on it until she builds her body. The normal adult should have 25% of their bacteria, Bifidobacter, Lactobacillus, and that's a normal amount. It means 25 trillions should be from that. But to fight cancer and all diseases, but the kids don't have it, you don't have it. So it doesn't matter. She's 23, then she have other problems then. Then she must have. Then she should see me or see gastroenterologist to find out. Gastroenterologist that believes in holistic medicine. Now, gastroenterologists believe in drugs.
Where are you located?
We located in Lake Villa in the border with Wisconsin by the Gurney Mills. Okay. Any other questions? Yes.
What different enzymes does the pancreas make?
Oh, the pancreas make 3 enzymes: trypsin, lipase, and amylase. And the EasyJust have the same enzymes. Okay? Yes, sir.
I've had hepatitis C for about 30 years.
We're going to be talking about hepatitis C in the Nutriferon lecture, but that is why I'm putting the lecture is for exactly hepatitis C. So you're going to wait until the next lecture, and we're going to talk about it. Because my mother died from it, my 3 brothers have it, so I'm very, very familiar with hepatitis C. I have a brother right now who actually have bleeding from that, and I just sent him the Nutriferon, and he's doing very well. So his count went down significantly.
With what?
Nutriferon. That's the one we're going to talk about in the next lecture.
Does that cause a lot of digestive problems?
No, when you have hepatitis C, you're going to have digestive problem anyway. So, yeah. So we're going to just have to teach the body slowly. But we can reverse it. I think we can. I think the Nutriferon lecture will help a lot to understand how can we improve the immune system against cancer, against allergy, against autoimmune diseases, against hepatitis C. We have articles published to show that.
When are you having this?
November, I believe he said, November 2nd, you said? Right, Joyce? If you put your name outside, you be sure your name, they'll let you know. Okay? Or call my office right here, and we can tell you when. Yes, sir.
Yeah, I've been reading that homogenized milk is really bad for the veins and all.
He said he'd been reading about homogenized milk, bad for the veins. If the homogenized milk have no hormones, still better than Coke or Pepsi. Okay? Any other question right there? No, 1 question per person, please. Yes.
I've had goats for 25 years, and I've always drank the milk straight from the goat. And been fabulous for me. Is it as good as I think it is?
Goat's milk is good. Cow's milk is good. In Egypt, we drink buffalo milks and goat milk there. We don't have lots of cows. But all milk are good milk. And I disagree with anybody who tell me that animal milk are bad for us. I absolutely disagree. Even it's in my course. American Board of Holistic Medicine telling us that you should tell patients don't ever drink milk. And I disagree with that. But in the exam, I will say, yes, you're right. Okay? Yes, ma'am. The what? GERD. Okay, let me tell the people what GERD is. GERD, when the stomach acid goes at night and goes in your lung and give you heartburn. It's a reflux esophagitis, okay? Gastrorefluxitis. That's because the sphincter between the stomach and the esophagus is loose. It could be from weight gain, whatever. But in general, Optiflora and EasyGest have done marvelous against GERD. Better than lots of the anti-acid. And calcium good, alfalfa also good. I forgot to mention about alfalfa, poor thing, I always forget about it every lecture. But anyway, I'm not going to include it right now. We'll wait until next lecture. Alfalfa is very good for that. When you eat lots of vegetables after you eat fruits, eat lots of salads is good for also GERD. Drinking soy protein before you go to bed with fruits also help against GERD. Any other questions? No, yes, I'll be back. If you have reflux and you don't have heartburn, then you lost your sensations here. Then I would be careful because reflux can lead to cancer of the esophagus. So if you have achalasia, means you have reflux without pain, that means you could develop cancer of the esophagus. Definitely, I'd be under the supervision of a gastroenterologist with a biopsy and gastroendoscopy once a year for do biopsy. And also I will be on all these diets, but I'd be careful that this area doesn't convert to cancer. Okay? I will come back to you again. Yes?
With the H. pylori bacteria in the small intestine?
No, H. pylori doesn't go to the small intestine. It's only in the stomach. Doesn't go there. But in the intestine, it's interesting you mentioned that because we have identified Klebsiella and connected it to HLA-B27 and ankylosing spondylitis, which is autoimmune disease like lupus, and it has the same Klebsiella gene DNA in it. So even ankylosing spondylitis, which is like lupus, came from Klebsiella. And another type of rheumatoid arthritis was related to Proteus mirabilis, which is another bacteria out of the 500 we said. So I think germs should not be there, period. And they have no business being there. Okay, yes, back there. Absolutely, yes. Yes, ma'am. The one you got mad when I take your question, yes. Okay.
I was hoping to hear you talk about Herblax.
Herblax, okay, Herblax, I should. Herblax is a combination of herbs that stimulate the colon for evacuation. However, it is better if you would have enough fibers in the diet and water and exercise to have the intestine move than depend on Herblax. You follow me or no? No, you don't. There is no herb used regularly unless you're under supervision by a doctor, because you can have dependency to any herb. Okay, we come back to your question right here. I'll be back with you in a minute. Yes, ma'am.
Okay, I have digestive problems. Do you suggest that I follow the instructions as they are on the back of the bottle for how many to take, or if it's like a chronic situation?
No, the question is, she have digestive problems. Should she follow the direction on the bottles? No. If you have digestive problems, you have to get a diagnosis on it first. If the doctor says it's all in your head, you don't have a problem, go to another doctor. So because there's nothing in the head, there is something. When your body talks to you, you listen. And we try to catch a problem before the body talks to you. We try to do it subclinically. We assume everybody have a problem, but we don't know it, we check it. But if your body tells you there's a problem, I would find out. But usually the recommendation of the company is correct to a person who have no symptoms. But somebody with symptoms must have diagnosis first, because you can miss cancer, you can miss perforated ulcer, you can miss ruptured appendix, you can miss something big. And believe me, killer diseases are killers, cancer and heart disease, aneurysms. You know, dissected aneurysm in the abdomen, don't you think it's going to give abdominal pain? You follow me or no? Don't take your health in your hand if it's going to lead to death. If you have shoulder pain, we know shoulder was not going to have anything wrong, then I take the pain relief complex, the alpha-alpha, the osteokinetic. There's nothing wrong with that. But if the pain in my chest, then that's a different story. That's not my shoulder. You follow me or no? So be careful, self-diagnose and self-treat, and listen to your friends. Be careful with that. Okay, yes, sir, the back. Oh, ma'am, I'm sorry.
My niece's daughter has got a fissure, a rectal fissure. It was a tear caused sometime when she was quite young. She had problems with constipation, very young, and the constipation has receded. It's not as bad, but she still has this fissure that causes discomfort. Do you have any suggestions to treat or heal this fissure?
Well, I want to ask you a question. I'm going to answer your question, but I will tell you something.